The death toll in the U.S. has officially reached more than 1,000, with more than 69,000 reported cases. That is a lot. Yesterday was the deadliest day in America so far, with about 250 deaths. 13 of those deaths were at the Elmhurst Hospital right here in New York City, where doctors say their supplies are just running out.
Late last night, the Senate passed a $2 trillion economic stimulus bill, including paychecks for individual Americans and billions of dollars in relief for medical providers and businesses. The bill now heads to the House, where it is expected to pass tomorrow. Meanwhile, Dr. Anthony Fauci, the head of the National Institute of Allergy and Infectious Diseases, warns there could be a second wave outbreak right here in America as Southern Hemisphere countries head into their winter.
If, in fact, they have a substantial outbreak, it will be inevitable that we need to be prepared that we'll get a cycle around the second time. Would this possibly become a seasonal cyclic thing? And I've always indicated to you that I think it very well might.
Oh, boy. Our Dr. David Agus joins us once again from his home in Los Angeles. Good morning to you, David. I want to pick up with what Tony Fauci just said. Hi. That we should maybe get ready for a second cycle. And my question is, how in the world do we possibly begin to prepare for that? We're in the middle of trying to figure out what this is that we're dealing with right now.
Hey, remember, I mean, things like the flu, there are multiple cycles, right? It comes and it goes almost every year. But we have a vaccine, we have treatments that work, and our medical infrastructure is ready for it. The same is going to happen here. You know, we were blindsided by this. We didn't know it was coming. We've taken dramatic measures across the country now, and we're going to be ready for the second cycle. I'm not focused on that or worried about that. I just want to complete what we're doing now, and the social distancing, it is starting to work. You know, it takes 2 to 9 days incubation period, and then the disease is 10 to 14 days in people. So we're going to see the benefits of the social distancing toward the end of this coming week and the weekend. So we all have to hold tight.
Doctor, we don't have great data on how widespread the disease is. The testing just isn't available. And yet we see these models about when it's going to peak. How are those models built if we don't have the underlying information nailed down?
You hit it. We are sorely lacking data. And you see models all over the place. You initially, 40 to 70% of the globe will get it. There will be a catastrophic number of deaths. And then a Stanford Nobel laureate said, well, we're actually doing very well. And over the next month or so, we're going to see a dramatic decline. You know, you see both angles. And part of the aggressive models say, we're not going to have treatments. We're not going to have care. We're not going to have a vaccine coming along. We're not going to be able to handle this. We're not going to social distance. But we are. We are making the impact that are going to prove the aggressive models wrong. The outcome is going to be better than that. And we're going to get through this.
David, we've seen it spread so fast here in New York City. What concerns you most about the possibility of it spreading in other dense cities?
I love hearing from you, Anthony. You know, obviously New York City, we had said, is the perfect place, right? Everybody's close to each other. You look at cities like LA, San Francisco, and others, there was a long period before we social distance where the virus had an opportunity to spread. And it is going to blossom in Los Angeles. It is going to blossom more in San Francisco. We're going to see, obviously, outbreaks that follow New York in those cities. We're prepared for them now, much better than we were before. And the social distancing that we all did is going to start to have its impact, again, the end of next week.
Boy, David, can you just emphasize one more time that social distancing is working? Because I still see some people, knuckleheads I'll call them, who haven't gotten the memo. It's very, very upsetting.
You're 100% right. I mean, it is upsetting to see that, but it is working across the country. It is the dominant way we're going to fight this virus. And what's amazing about it is that people are stepping up. There are a few knuckleheads on beaches here and there, but America, to its part, it's doing it. And I'm proud of what America is doing, and the impact will be there. We will slow this virus. We are slowing this virus. And it's frustrating because there's a lag between what we're all doing, changing our life and our interactions, and the effect on the virus. But it is happening, and we will see it. I promise you it's happening.
All right. I believe you, Dr. David Agus, but we are a country of hurry up, make it happen now. It doesn't always work that way. Thank you, sir. I know we'll see you later on.